A 63-year-old patient sat across from me, and what he said stopped me cold. He looked down at his hands and said, "Dr. Brooks, I haven't felt like a real man in 2 years. I've tried everything. My marriage is suffering. I've started avoiding my wife just to avoid the embarrassment. I thought this was just what happens at my age." Gentlemen, I hear some version of that story almost every single week in my practice, and every time my answer is the same. No. This is not inevitable. And yes, there is something simple you can do about it, starting tomorrow morning. Today, I'm going to show you a simple morning technique, one that takes under 10 minutes, costs nothing, and works with your body's own biology to restore strong, reliable erections. And the best part? It works on the first try for most men, because it targets the actual root cause that almost no one is addressing. Stay with me through all of this, because the technique itself comes with a sequence, and step 3 is the one most men skip entirely, which is exactly why they don't get the results they're looking for. I'm Dr. Amanda Brooks, a urologist with 12 years of experience helping men over 60 reclaim their vitality, strength, and confidence. I've worked with thousands of men who thought their best days were behind them, men who had given up, who felt too embarrassed to ask, who had accepted a version of life far smaller than what they deserved. My mission is simple: to give men the real science behind what's happening in their bodies and the real tools to do something about it. No shame, no judgment, just honest medicine. Before we go any further, do me one quick favor. Tap the like button right now and drop a comment below telling me where you're watching from. It takes 2 seconds, and it genuinely helps this information reach the men who need it most. Now let's get into the science. Here is what's actually happening and why this matters so much. Erectile function is not simply about desire or testosterone. At its core, it is a vascular event. An erection happens when the smooth muscle tissue inside the penis relaxes, allowing blood to flood into 2 chambers called the corpora cavernosa. When that works properly, the result is strong, full, and reliable. When it doesn't, the issue is almost always in the blood flow, the nerve signaling, or the tissue quality, not in your character, not in your masculinity, in your plumbing and your chemistry. Problem number 1. After 60, nitric oxide production declines dramatically. Nitric oxide is the chemical signal your blood vessels release to relax and dilate. It's the trigger for every erection you've ever had. Without enough of it, even strong arousal can't produce a reliable physical response. Think of nitric oxide as the key in the ignition. Desire is wanting to drive, but if the key doesn't work, the car doesn't start. Problem number 2. Sedentary morning behavior actively suppresses vascular function. When men wake up and immediately reach for their phone, sit in a chair, or lie in bed for another hour, they are missing the body's single most powerful natural window for restoring nitric oxide levels. Cortisol peaks in the first 30 minutes after waking. Blood pressure is lower. The body is primed for a specific hormonal reset, and most men sleep right through it or squander it. Problem number 3. Pelvic floor dysfunction is almost never discussed, and it is quietly destroying erectile function in millions of men over 60. The muscles that regulate blood retention in the penis during an erection are part of the pelvic floor. When those muscles are weak, atrophied, or simply never trained, erections become soft, brief, and unreliable, regardless of how healthy everything else is. No pill in the world strengthens a weak muscle. Only the right movement does. So what is the morning technique that addresses all 3 of these root causes simultaneously? Let me walk you through every step. The technique has 5 components, performed in sequence each morning. Together, they take between 8 and 12 minutes. Let me break each one down scientifically, emotionally, and practically. Step 1. The sunrise nitric oxide walk, minutes 1 through 3. Within the first 10 minutes of waking, your body's endothelial cells, the lining of your blood vessels, are highly responsive to light and movement. A brisk 3-minute walk outside, or even near a bright window, triggers endothelial nitric oxide synthase, or eNOS, to produce a morning surge of nitric oxide. Researchers have found that even brief morning light exposure, combined with mild movement, increases eNOS activity by a measurable margin compared to men who remain sedentary. It's like priming a fuel pump before you start the engine. I know what you might be thinking. Doc, I'm not a morning person. I hear that a lot. But here is what men tell me after just 2 weeks of this practice. They feel more alert, more alive, more capable before they've even had coffee. There is something profoundly confidence-building about starting the day with intentional physical action. Your body responds and your mind follows. Step outside within 10 minutes of waking. Walk briskly for 3 minutes, fast enough to feel your heart rate rise slightly. No shoes required on grass if possible. Grounding has been shown in pilot studies to reduce cortisol. No earphones during this portion. You are training your nervous system to be present, not distracted. Return inside and move immediately to step 2. Step 2. Diaphragmatic breathing. The nitric oxide amplifier. Minutes 3 to 5. Nasal breathing during deep diaphragmatic exercise produces nitric oxide in the nasal sinuses. This is a well-documented physiological mechanism. The nitric oxide produced there travels directly into the bloodstream and enhances vascular dilation throughout the body, including in penile tissue. Slow, deep nasal breaths with a 4-second inhale, 4-second hold, and 6-second exhale activate the parasympathetic nervous system, the branch responsible for sexual arousal and vascular relaxation. This is not a relaxation exercise. This is a targeted vascular therapy. Many of my patients tell me that the breathing portion of this technique is when they first notice a physical change, a warmth, a sense of blood moving. That sensation is meaningful. It is your body responding to care. For men who have felt disconnected from their own physical vitality for years, that feedback can be quietly transformative. Sit or stand. Breathe in slowly through the nose for 4 counts, expanding the belly, not the chest. Hold for 4 counts. Exhale slowly through the nose for 6 counts, drawing the belly inward. Repeat for 2 full minutes, approximately 10 to 12 cycles. Keep your mouth closed throughout. This is non-negotiable for the nitric oxide production pathway. Let me tell you about David, 66, a retired firefighter from Texas. He told me, "I felt like a stranger in my own body. I'd stopped initiating anything with my wife because I was terrified of failing again." After 3 weeks of this morning protocol, he came back to my office and said, "I don't know exactly what changed, but something definitely did. The confidence came back before anything else." David's experience reflects what the science predicts. Restore the vascular signaling, and confidence follows the physiology. Step 3. Pelvic floor activation. The step most men skip, minutes 5 to 8. The ischiocavernosus and bulbocavernosus muscles, your pelvic floor, are the muscles that compress the veins draining blood from the penis during erection. When they contract firmly, they maintain pressure and sustain the erection. When they are weak or uncoordinated, blood escapes, erections fade, and rigidity decreases. A landmark clinical trial published in the British Journal of Urology found that pelvic floor exercises resolved erectile dysfunction in 40% of participants and significantly improved function in another 35%. That is comparable to or better than first-line pharmaceutical options. Here is the truth about why men skip this step. It feels unfamiliar, even strange at first. We don't grow up being taught to connect with these muscles, but I want you to think about it this way. Every other muscle in your body benefits from training. Why would you expect this one to be different? The men who commit to this step consistently report the most dramatic and lasting improvements. This is how to find and train your pelvic floor. Sit or lie down. Contract the muscle you would use to stop the flow of urine midstream. Hold that contraction for 5 seconds. Release completely for 5 seconds. That is 1 repetition. Perform 10 repetitions. Then perform 10 rapid, rhythmic contractions. Squeeze and release every second. This full set takes approximately 3 minutes. Do it every morning without exception. Results typically begin appearing within 3 to 6 weeks with daily practice. Step 4. Cold water activation, minutes 8 to 9. Ending your morning shower with 60 seconds of cold water, specifically directed at the lower abdomen and inner thighs, triggers a physiological response called the cold shock response. This causes a rapid release of norepinephrine, increases testosterone receptor sensitivity, and stimulates blood vessel reactivity. Think of it as a vascular training session. Just as muscles strengthen under resistance, blood vessels improve their tone and responsiveness through controlled temperature stress. Cold water is not comfortable. That is precisely the point. Every morning that you choose to do something uncomfortable for your own health, you are reinforcing a powerful psychological identity. I am a man who takes care of himself. That identity compounds over weeks and months into a level of confidence and self-respect that reaches far beyond physical function. After your normal shower, reduce the temperature to the coldest comfortable setting. Direct the stream toward the lower abdomen, pelvis, and upper inner thighs for a full 60 seconds. Do not hold your breath. Maintain the diaphragmatic breathing pattern from step 2. 1 minute is the minimum effective dose. 30 seconds is not enough. 60 seconds is the threshold at which norepinephrine release becomes clinically significant. Michael, 71, a former accountant, came to me after his doctor had already prescribed a popular erectile medication. He said, "The pill works sometimes, but I hate relying on it. I want to actually fix this." After 6 weeks on this full protocol, Michael returned and said, "I took the pill twice last month, not because I needed it, but just to see. I honestly don't think I need it anymore." Michael's story represents what I see again and again. The protocol doesn't just manage the symptom, it begins to restore the underlying function. Step 5. The intentional nutrition window within 30 minutes of waking. Nitric oxide production depends on specific dietary precursors, particularly the amino acids L-arginine and L-citrulline, along with dietary nitrates found in dark leafy greens and beets. Consuming a small targeted morning meal within 30 minutes of waking during the peak cortisol window optimizes the body's ability to convert these precursors into active nitric oxide. The morning cortisol spike actually enhances amino acid uptake, making this the single best metabolic window for supporting vascular health. Nutrition for men's health doesn't have to be complicated or expensive. Knowing exactly what to eat in the morning and why gives men a sense of agency that I find profoundly meaningful. You are not just waiting to see if your body cooperates. You are feeding the exact biological process that supports your vitality. Within 30 minutes of completing the protocol, eat one of the following: a small bowl of oatmeal with a tablespoon of ground flaxseed, 2 scrambled eggs with a side of arugula or spinach, or a smoothie containing half a beet, 1 cup of spinach, and a banana. For targeted supplementation, 3 grams of L-citrulline daily, available in powder form, has strong clinical evidence for improving erectile function by increasing circulating nitric oxide levels. Take it with your morning meal, not on an empty stomach. Thomas, 68, a high school football coach, told me he'd been avoiding intimacy with his wife for over a year. He said, "I kept making excuses. I told her I was just tired, but the truth is I was afraid." After 8 weeks on the full morning protocol, including the nutritional component, he told me, "Doc, I feel like I'm 48 again. My wife noticed before I said a word. She asked what I'd been doing differently." That is what restoration looks like, gentlemen. Not management. Restoration. Here is your complete morning protocol. 5 steps under 12 minutes starting tomorrow. Step 1. Within 10 minutes of waking, take a brisk 3-minute walk outside in natural light. No phone, no distractions. Step 2. Perform 2 minutes of slow nasal diaphragmatic breathing. 4 counts in, 4 hold, 6 out. Mouth stays closed. Step 3. Complete your pelvic floor sequence. 10 long holds of 5 seconds, then 10 rapid contractions every single morning. Step 4. End your shower with 60 seconds of cold water directed at the lower abdomen and inner thighs. Breathe through it. Step 5. Within 30 minutes of waking, eat a nitric oxide supporting meal. Consider adding 3 grams of L-citrulline powder if you want to accelerate your results. That is the complete protocol. 5 steps, under 12 minutes, starting tomorrow morning. If you've been carrying frustration, embarrassment, or a quiet grief about this part of your life, I want you to hear this from me directly, as your doctor. You are not broken. You are not less of a man. What you have been experiencing is a biological response to factors that are genuinely addressable. And the fact that you are here, watching this, taking this seriously, tells me everything I need to know about the kind of man you are. The men I have seen restore their vitality after 60, after 65, after 70, share one thing in common. They stopped waiting for something to change on its own, and they took one small, consistent action. That is it. That is the entire difference. Your body is not done with you. It is waiting for you to give it what it needs. And now you know exactly what that is. If this video gave you something real today, I have one request. Like it, and leave a comment below telling me which of the 5 steps you're committing to starting tomorrow morning. That accountability matters, to you and to the other men reading the comments. Share this with one man in your life who needs to hear it. A son, a brother, a friend. The conversation you make possible by sharing this video might be the one that changes his life. And subscribe to this channel. Every week I bring you the real science of men's health after 50, without the shame and without the noise. I'm Dr. Amanda Brooks, reminding you that after 50, vitality isn't lost. It's waiting to be awakened. Take care of yourselves, gentlemen. I'll see you in the next one.